Good afternoon. My name is Shaye Ross. Today, for my public health mini talk, we'll be going over the opioid crisis. I think this is a really important public health problem that affects all of America and really the world, but mainly America, though. Let's begin. Uh, these are my table of contents. This is a little quick overview of what we're going to be going over. One, we're going over the definition and magnitude. Two, we'll be going over importance and factors. Three, we're going to be going over what's currently being done to help. And four, we're going to go over questions I have for the viewer. Let's continue. First off, we have definition and magnitude. All right, definition. When we refer to the opioid crisis, the opioid epidemic refers to the serious public health issue stemming from the rapid increase in use of prescription and non-prescription opioid drugs. Uh, let's continue. Magnitude. Overdose deaths remaining a leading cause of non-injury related deaths in the United States, and majority of these deaths are as a result of opioids. Although there are many fatalities, uh, there are even more non-fatal doses. The group that's affected the most would be the 35 to 44-year age group, and they experience the most opioid overdose deaths, which is 20,137, which is a 20% increase from 2020. 7 out of 10 preventable opioid overdose death victims are in fact male, 53,992 compared to 21,793 female deaths in 2021. Let's continue. Number two, we'll be going over importance and factors. Importance, overdose deaths remaining a leading cause of non-injury related deaths in the United States, and the majority of these deaths are as a result of opioids. We must work to reduce unnecessary deaths. Our healthcare system must ramp up efforts to address the opioid crisis. I think the opioid crisis is extremely important. The numbers I showed you before they're too high. I think these deaths can be prevented with the right things put in place. Factors of the people that are affected by the opioid crisis are typically those that are middle aged, those with a history of substance abuse, including prescription and illicit drugs and alcohol, comorbid mental and medical disorders, high opioid dose, antidepressant co-prescribing, and unemployment. Three, what are states doing to help? We'll use New York for an example. For example, they're identifying and sharing data between agencies and affected communities. They're also developing training for healthcare providers on addiction, pain management, and treatment. They're making prescription drug monitoring programs easier for providers to access and use. They're also providing resources to assist communities in combating the opioid epidemic at a local level. And they're also coordinating statewide and community programs to improve the effectiveness of opioid prevention efforts. Let's continue. All right, questions. The first question I have for the viewer is, do you have any family members that take opioid medication? I think this is really important because in order to address this public health issue, I think it's important to look at an individual level. And I think that we can look at our grandparents or immediate family members and see what they're being prescribed or if there's a problem in that. And I think this is just a really important question that you should probably ask yourself in order to combat this public health issue. For my second question, this is more so a follow-up to the first question I gave. This would be, what new methods would you enact to prevent/stop the opioid crisis within your community? I think this is a really important question because if we move away from individual, I think it's also really important to look within our community because that's when you're able to see the effects firsthand or see how a public health issue is really affecting your community. I think it's important that we're all able to come up with ways to prevent/stop the opioid crisis or ways to help within our communities. So I asked, like, what would you be able to do within the West End or within Atlanta in order to stop this opioid crisis? I think this is really important. Um, and that is the end of my presentation. I think the opioid crisis is really important. I think there are deaths that can easily be prevented, and Thank you for listening.